Hi, my name is Danielle Mueller. I'm here to talk to you today about the human skull. This would be more if you looked at, an actual human skull, you would see it looking like this, no paintings, no markings. You can see the suture lines where the bones meet together there, but it's very plain. You can see there's just different holes, features on here. This skull that I'm going to primarily work with here has numbering on it because it came with a key, and also the sutures have been kind of highlighted with this yellow paint here, so this really helps you see clearly and the defined places where the bones are actually coming together and meeting, and you can tell where one bone starts and where it stops. So we'll focus on this skull here when we do this demonstration. I'm going to start here with the frontal bone, which is in the very front of the skull here. As you move more posterior and laterally, you can see the two parietal bones here. As you move further to the back on the very posterior part of the skull, you see the occipital bone back here. As you turn the skull, we're going to talk about these sutures that are in between the frontal bone and the parietal bone. You would see the coronal suture running here. Between your two parietal bones, you see the sagittal suture running right down the middle of the skull. And then as you turn towards the back, between the two parietal and your occipital bone is the lambdoidal suture. When we turn to the lateral side of the skull, you can see this suture right here is going to be the squamosal suture, and that separates the parietal bone from the temporal bone. The bones we discussed previously don't have a lot of features or markings, so we didn't really talk about them in depth. Now we're moving to some bones that have different features. On your temporal bone, you can see the external auditory meatus, that's the opening of the ear. The mastoid process is this large process right here, and then the styloid process is this small little piece of bone right here. Coming off of your temporal bone, you have the zygomatic process of the temporal bone. So it's named for the bone it's going towards, not the bone that it's coming off of. So then right here is your zygomatic bone, and the part right here is the temporal process of the zygomatic bone. If you talk about the whole arch right here, that's considered the zygomatic arch. As we turn back to the anterior view of the skull, you can see the lacrimal bone, which is right here. It's only about the size of like the tip of your finger right here, and you usually can tell exactly where it is because you're going to see this hole right here. That is the lacrimal canal, so that's a hole going through the lacrimal bone. It connects the eye and the nasal cavity there. Coming immediately, you'll see right here is the nasal bone. It's made up of two bones that come together right there at the bridge of the nose. That's where, like right here where your glasses would sit. If you go inferior to that, you're going to see the maxilla or maxillary bone right here. It has the infraorbital foramen, the little hole right here. And you can see where all the teeth are. This guy's missing a lot of teeth, but where all the teeth come together, each one of these little bumps right here is going to be an alveolar process. So if I just switch over to this one, since he has all his teeth, each one of these bumps is going to be an alveolar process where the teeth are attached there. Let's see. Looking back kind of at the orbit here, right above the orbit you have that supraorbital notch or foramen. In some people it is an actual foramen, so there's a little piece of bone coming across right here, and a lot of people it's a very small bony strut. It gets broken, so it almost appears as just a notch. In the orbit itself, where the eyeball would sit here, there are a couple different features. You have the optic foramen, which is the hole running right through here. You can see where the pipe cleaner is going in. That's where the optic nerve runs through into the inside of the skull. So if we open the skull up, you can see that it travels into the interior of the skull. You also have the kind of boomerang C-shaped structure right there. The top part is considered the superior orbital fissure, and the bottom part is the inferior orbital fissure. When you look inside the nasal cavity here, you have this nasal septum, which is actually made up of two different bones. The bottom part is made of the vomer, and the top part is the perpendicular plate of the ethmoid. The ethmoid you can see mainly on the inside of the skull, and we'll get to that in a minute. And another feature that you can see is you have these little like bony scrolls, almost like little shelves of bone inside here. You have the middle nasal concha here and the inferior nasal concha here. If we go back looking at that maxillary bone here, the maxilla, if we tip and look at the base of the skull here, the maxilla, this is still part of the maxilla here, the hard palate. So this is the palatine process of the maxilla. The hole that you can see right here at the very front of that hard palate would be the incisive foramen. And then you have right here the median palatine suture in between the two pieces of that palatine process there. The back part of the hard palate, so that bony palate and the roof of the mouth, you have a suture here. This right here is the palatine bone itself. To either side you have the greater palatine foramen that you can see to each side there. And the palatine is its own bone, but it's only a small portion of that actual hard palate there. When you look at the rest of the base of the skull, you can see a lot of foramen and holes, canals. There are a lot of different canals where you have blood vessels and nerves coming through that are in the base of the skull here. So when you look here, you have, on each side, you have the foramen ovale. Right next to that is the foramen spinosum. It's that little small hole kind of underneath the foramen ovale. Coming up more towards the midline, you have the foramen lacerum here on either side. And then if you move further down, you'll see the carotid canal here, and that's where the carotid artery would travel through. And then below that, kind of this jelly bean shaped structure right here is going to be the jugular foramen, and that's where the jugular vein enters into the skull. The large hole that you see right here is the foramen magnum. That's where the spinal cord exits from the brain. And to either side of that, right here, you have that a hypoglossal canal, and that enters into the skull as well. To either side of the foramen magnum, you have these flat articular surfaces right here, and that is the occipital condyles right here. When we turn and go into the inside of the skull, we can see some of the extent of some of the bones we talked about previously. The ethmoid bone is right here. We talked about that previously. The perpendicular plate right here of that nasal septum is part of the ethmoid bone. This is another extent of that here, so all of this is considered the ethmoid. Running right down the middle here is the crista galli. To either side of the crista galli, you have the cribriform plate. The cribriform plate actually has many little tiny holes in it. Here it just kind of looks great because people have touched it with their pencil, but if you had an actual human skull, you would see actual tiny little holes that are about the size of like a straight pin that could fit through it, and that's where the olfactory nerves come up from that nasal cavity that go up to the brain. If we move further down here, we can see the sphenoid bone. So we saw the sphenoid right here. So coming inside, this is the major extent of the sphenoid here. A lot of times people think it looks kind of like a bat or a butterfly with the kind of wing-shaped structure right here. So these parts that kind of jut out right here are the lesser wings, and the major portion right here are considered the greater wings of the sphenoid. A bunch of the foramen we've looked at previously we can see from a different view here. So this was that optic foramen, so that meant that came out through and into that orbital cavity. That's where the optic nerve travels into the brain. You can see the foramen ovale right here, the foramen spinosum, again right below it, smaller. More towards the midline is the foramen lacerum. And then up here, you couldn't see this one on the base of the skull, this is the foramen rotundum. And each of them have a corresponding pair on the other side of the skull. Another feature of the sphenoid would be the sella turcica right here, this indented portion right here, is where the pituitary gland sits, and it stands for, like, another name for it is the Turkish saddle, is what Saliturska means in Latin, because it almost looks like a little saddle. You can imagine someone sitting in here and putting their feet to either side. So that's a Saliturska right here. As we move more posterior, we move from our sphenoidal bone to the temporal bone. So the temporal bone was out here on the outside here. So this is the inside of our temporal bone here. You can see this large bony shelf here is the pederis portion of the temporal bone. On that, the hole that you see right here, that's the internal auditory meatus. Inferior to that, we see that, once again, that jelly bean, kidney bean kind of shaped opening, that hole right there, that's that jugular foramen. And then as we move further down, we move into the occipital bone again. You see that foramen magnum with the hypoglossal canals to either side of it. So that's the major components that you see inside of the skull. One of the last bones that we look at that belongs with the skull is the mandible. The mandible is the lower jaw. It will articulate with that mandibular fossa, so our mandibular fossa right here, those depressions, that's where the mandible articulates, and you see that movement of the mandible with the opening and closing of the mouth. So the mandible is divided into 3 regions. You have the main portion right here, the body. As you kind of turn and you see this bend right here, that's going to be the angle of the mandible, and then this top portion here, after you've kind of made that turn, is the ramus of the mandible. You have 2 sets of foramen on the mandible. You have the mental foramen that you see on the front of the mandible, and as you turn to the posterior side, you have 2 more foramen right here, and those are the mandibular foramen. The last 2 features on the mandible would be the coronoid process here that sticks up, and then the mandibular condyle on the very posterior part here, and once again, that was what was articulating with the mandibular fossa. You can also see, just like on the maxilla, you have alveolar process, you can see the alveolar process on the mandible as well. I hope this tutorial has helped you get a better understanding of the different features of the skull, the bones, all the canals, openings, processes that you see on the skull. So I hope this helps and it makes your study of A&P a little bit easier. Thank you.